what are the pros and cons of CAR T cell therapy versus bispecific antibodies? I think, you know,
Rajeeve,
I chimed in a little bit on this earlier, but we can, again, it's, you know, CAR T cells, I think the main sell point of CAR T cells, and again, it depends on what disease we're talking about, but, you know, they're a one-time therapy that's intensive and labor intensive and requires quite a bit of workup, but it's one and done, and hopefully a long, durable remission, which is great. And I think all patients value being off treatment. So I think that's a big selling point of CAR T cells. The disadvantages of the CAR T cells, you know, expense, although all these things are expensive, and it takes time to engineer this. You know, patients referred to my clinic, you know, I have to say, I think you need a CAR T cell. So that's the first step. So they have to be from the community. They got to get an appointment and see me. We see them fast, but there's still some delay. I have to say, I think you need a CAR T cell. They have to undergo an evaluation, almost similar to like a stem cell transplant, where we know they have social support, logistics. We have to then collect their cells. They have to engineer the cells. That whole thing takes, you know, 6 to 8 weeks, sometimes even longer, depending on slot availability. So that's a major disadvantage. And for some of our patients, they cannot wait that amount of time. Bispecifics, you can give, it's right off the shelf. They don't need to cook it. It's already made. And it can be given once you get approval immediately. I think a big disadvantage currently is their continuous therapies. Although in lymphoma, there are now some studies discontinuing the bispecific antibodies. They just presented at ASH where they discontinued one of the CD20 bispecifics, and there were very durable, complete remissions, perhaps cures. In myeloma, I would ask the myeloma experts in the room, are they looking at discontinuation studies in the bispecifics?
Yeah, for sure. I think some of the studies are looking at either 12 to 24 months of bispecific treatments. And I think it's a very important point, because one of the things that we do see with the bispecifics is a high rate of infection, particularly severe infections. And whether this is related to the bispecific, or of course, these are patients who have been through a lot of different treatments, 5 or 7 treatments sometimes. So it could also be that the patients have a weakened immune system, but nevertheless, I think what we see certainly is something we need to watch closely. And I think one of the ways to try and avoid that might be to give a defined duration of treatment.